Hello, Diaz here, founder and owner of Greenwood Dental. Welcome back to another video. This week, I would like to talk about a procedure called frenectomy. And the reason why I need to make a video about the process of frenectomy or the indication of frenectomy is because I have been seeing new patients, little ones, between age 2 and 3 years old. And the parents are very confused as far as why frenectomy is needed and how would that affect the child's mouth. So frenectomies are basically procedures that are required for many reasons, but let me explain to you what a frenum is. The two frenum attachments, mean muscle attachments, that we are constantly concerned about or involved with is a very small muscle attachment that holds the upper lip to the center between the two front teeth, and a small attachment that holds the lower lip, that holds the tongue to the floor of the mouth. And also there's another one that holds the lower lip to the midline between the two bottom teeth. So there are three, so the top, the bottom, and the one under the tongue. The one we are mostly concerned about is the one on top and the one under the tongue, especially for newborn patients. Newborn babies, if they're having a hard time to latch in order to nurse, that's a huge concern for the pediatrician. And because they need to feed, whether they feed nursing from a mom or they feed nursing from a baby bottle. So it's up to the pediatrician to say, okay, we try latching and they're not feeding and the frenectomy is necessary. So what the frenectomy is, anything ends up with an ectomy, meaning snipping off. So what they do, they snip it off, detach it, and hoping for it to relocate itself into a lighter or less tight of an attachment. That way the child can feed or the baby can feed and they can take a bottle or they can nurse. Now, if they are not being affected with the latching process and they can feed fine, usually at 2 or 3 years old, if they are having a hard time swallowing or having a hard time clearing their airway, then we will look at the attachment of the one under the tongue and see if it's too tight. I have patients that it actually attach all the way to the tip of the tongue. Also, what we see with children, if they grow out of the challenge of latching or nursing or feeding, but they start having a hard time with their R's and L's, that will affect their articulation and their pronunciation, the speech, and some of them will end up in speech therapy. So I always tell the parent that if the frenum attachment is short or tight, but it's not interfering with the function of the child or it's not affecting, again, speech or feeding, then let's monitor it. And sometimes as the jaw grows, and remember, this is just my observational data and it's subjective. As the jaw grows, I have seen children correct even a class 3 bite, which is an underbite. And I know that many children has corrected the frenum, or sometimes they just fall. When they have trauma and they fall, the frenum will tear and it will correct itself. So not every frenum or tight frenum needs a frenectomy. We'll leave it up to the pediatrician, like I said, when the child is born. But also if the child is at 2 or 3 years old and having a hard time with the attachment, with the function that I mentioned earlier, then we would recommend, and it won't correct itself, we would recommend the frenectomy. So it is definitely the final decision to the parents whether to do the frenectomy or not, snip it or not, correct it or not. It's up to the parent, the final decision, but please consult with your dentist. Obviously, we see the child every 6 months. With a pediatrician, they see them once a year. So we see the children a lot more often than the pediatrician does. So we are a lot more on track with the child developmentally more than pediatrician. And that's why we sometimes ask as far as any challenges with speech, challenges with, can they use a straw? Can you use a sippy cup? How they're doing with bottles? So far and so on, as far as function. So keep that in mind. If you guys have any questions, please ask, but it's not really a straightforward answer per se. It really depends on the child, like I said, and development and how they're functioning with such attachment. I have kids that never had a frenectomy and they just grew out of it. The only thing sometimes we'll see is the space between the front two teeth, and that's more aesthetic and cosmetic. And some of the parents saying like, what can we do? We do realign the teeth. Some of the kids end up with closing the space with ortho braces. But if the frenum attachment is very thick and very prominent, it will keep the teeth apart. And that could be frustrating for the parents after paying X amount of money for ortho and the space keeps opening. And that's when we get into putting a fixed wire between the two teeth to keep the teeth apart. But if the frenum that thick, sometimes the orthodontist will recommend to correct it before even we start realigning or moving the teeth. So I hope that helped, and I hope that answers some of these questions. Please leave a comment if you guys have any concerns or any challenges. I'll be very happy to answer those. So be well, be safe. We love you. DS out.